The American Cancer Society estimates there will be more than 19,000 new cases of ovarian cancer this year in the United States. This month, September, is Ovarian Cancer Awareness Month. So let's check in with UofL Health's Dr. Whitney Goldsberry, who specializes in treating this type of cancer. Thank you so much for coming on today, first of all.
Thank you.
Let's start by talking about ovarian cancer. What exactly is it?
Ovarian cancer is a type of cancer that actually originates in the ovaries. But very similarly, the fallopian tubes that are right next to the ovaries and cancer that starts in the peritoneal lining, which is like the lining of the abdomen, all of those are treated the same way.
Okay, so what are some of the risk factors that you are aware of that might make someone more likely to come down with this disease?
So overall, the risk of a woman getting ovarian cancer is pretty rare. It's about 1 in 80 or just over 1% in the general population. But women who have specific mutations can make them more at risk of having an ovarian cancer, along with certain types of breast cancers. Just in general, women who are older in age, who haven't had any children, who went through menses earlier in their life, or go through menopause later in life, all are at a higher risk of having an ovarian cancer.
Okay, it's good to know that. Very important, some signs or symptoms that something might be wrong.
Yes, ovarian cancer is actually really hard to detect just by its symptoms, which makes it very deadly because by the time we actually find it, oftentimes it's in advanced stages. Some of the symptoms that you can be on the lookout for would be just very general things like increased urinary frequency, sometimes constipation or abdominal bloating, or women can have early satiety, which means that they feel full very quickly, but most of the times, often the symptoms are just very vague.
If someone does get diagnosed, what can you do to help them?
So the first things we need to do is evaluate how far advanced the cancer actually is. Once we figure that out, both the combination of surgery and chemotherapies are what we do to treat it.
Okay, very good to know. Dr. Goldsberry, thank you so much for coming on and joining us here again.
Thank you.